Carpal tunnel syndrome is a really common condition that affects the hands. Generally speaking, it causes pins and needles in the thumb, index and middle fingers. And the problem is all here around the carpal tunnel. The nerve, the so-called median nerve, passes underneath this thickened ligament. Nerves don't like being compressed, and as a result, patients experience tingling in the thumb, index and middle finger, whereas the little finger and perhaps half the ring finger are spared because their nerve, the ulnar nerve, passes over the top of that ligament. The classic patient is female in their middle age. They will wake regularly from their sleep with pins and needles in these three fingers. They will feel like their fingers are swollen like sausages, and they'll often shake their hands to gain relief, and I call that the wake and shake test. When we come into an examination, that's the history that we're looking to take from a patient. Pins and needles in these three fingers, particularly bad at night or driving or reading a newspaper. If the story is quite classic, well with the examination, we then don't need to do any special tests. The examination that we do for carpal tunnel syndrome is trying to excite this nerve, and this is sometimes by tapping on the nerve over the carpal tunnel. And if tapping over the nerve causes pins and needles in these fingers, that's quite a strong suggestion that you've got carpal tunnel syndrome. But also, just applying some direct pressure over the carpal tunnel, pressing and then perhaps even flexing your wrist forwards, again, increases the pressure in the carpal tunnel, and after 10 or 15 seconds, if that reproduces the symptoms in these fingers, you may have carpal tunnel syndrome. There are some special tests that we occasionally arrange for patients, and these are called nerve conduction studies. And this involves putting some little electrical pads on the tips of the fingers and on the forearm, and recording the electrical speed above and below the carpal tunnel, and then comparing it to the ulnar nerve which goes over the ligament. And if there's some slowing up of the conduction through the carpal tunnel, then it's highly likely you have carpal tunnel syndrome. Once we've made a diagnosis of carpal tunnel syndrome from a good history, a clinical examination and occasionally some nerve conduction studies, we then talk about treatment options. The treatment options are, well, do nothing, that is an option, but occasionally things can get worse and worse and the nerve may become permanently scarred. So we don't usually advise that as an option. One of the other options is a cortisone injection. Usually under ultrasound guidance by my radiologist, a small needle is inserted into the carpal tunnel, avoiding the nerve, and a low-dose corticosteroid injection is performed. And this can often improve the symptoms quite significantly. If this fails to give long-lasting benefit or the patient doesn't want to have that injection, we may look at doing surgery. And surgery involves incising, making a cut in this ligament to make some more space so that the nerve can run freely. The surgery now is performed under local anaesthetic, wide awake, without the need of a tourniquet. I put some adrenaline, which is a chemical, into the local anaesthetic, which stops any bleeding, and this surgery can perform relatively painless without the need for this really painful tourniquet that many surgeons still use to this day. Once I've done the operation, I've freed up the nerve, I put an absorbable stitch underneath the skin, and then I secure the wound with some butterfly stitches and then a small light dressing. The dressing allows your fingers to be free and allows your wrist to be free. I'll let you do most activities, but I do want you to keep your wound clean and dry for the first 10 days. I want you to avoid lifting anything heavy for the first 2 to 3 weeks. After this type of procedure, you can return to work pretty quickly depending on what you do. If you've got an office-based activity, you may even go back to work that afternoon. But if you're more of a manual type worker, where you're having to get your hands dirty, it may be several weeks before you get back to work. Return to drive, well, return to drive is whether you're safe to control a vehicle in an emergency. And I do have a number of patients who have this surgery and then drive themselves home. If they feel they can feel their hands, they can grip the steering wheel, and they can turn their steering wheel in an emergency, perhaps to swerve out of the way of a dog, then they're fit to drive. But generally speaking, we do usually recommend somebody drive you to and from the operation, just in case you can't feel your fingers after the operation until the local anaesthetic has worn off. There are risks associated with any of this surgery, and these are all detailed on my website under the carpal tunnel section. Post-operatively, I'd like to keep your wound clean and dry for the first 7 to 10 days. Perhaps reduce the dressing down to just a simple sticky dressing after the first 2 to 3 days. And then I'll usually follow you up for a consultation several weeks after the operation. Because I use absorbable stitches, there's no stitches to be removed, and I could either see you in a consultation room such as this after 6 to 8 weeks, or increasingly we're using telemedicine just to dial in to make sure you're doing okay. Of course, a telemedicine consultation never replaces a true face-to-face consultation in clinic, and if you want that, we can always arrange that via my secretary. She can be emailed info@mypage.